What is Triumeq? Triumeq contain a combination of Abacavir, dolutegravir, and lamivudine. Abacavir, dolutegravir, and lamivudine are antiviral medications that prevent human immunodeficiency virus, HIV, from multiplying in your body. Triumeq is used to treat human immunodeficiency virus, HIV, the virus that can cause acquired immunodeficiency syndrome, AIDS. This medicine is not a cure for HIV or AIDS. Triumeq is for use in adults and children who weigh at least 22 pounds, 10 kilograms. Triumeq should not be used by itself in those who are resistant to certain types of medicine. Warnings: you should not take Triumeq if you have ever had an allergic reaction to any medicine that contains Abacavir, or if you have a gene variation called HLA-B 5701 allele. Also, you should not use this medicine if you have moderate or severe liver disease, or if you are also taking dofetilide, Tikosyn. Stop using Triumeq and call your doctor at once if you have any of these signs of an allergic reaction to this medicine: fever, rash, nausea, vomiting, diarrhea, stomach pain, general ill feeling, extreme tiredness, body aches, shortness of breath, cough, sore throat. If you've had hepatitis B, it may come back or get worse after you stop using Triumeq. You may need frequent liver function tests for several months. You may develop lactic acidosis, a dangerous buildup of lactic acid in your blood. Call your doctor or get emergency medical help if you have unusual muscle pain, trouble breathing, stomach pain, dizziness, feeling cold, or feeling very weak or tired. Before taking this medicine, you should not use Triumeq if you are allergic to Abacavir, dolutegravir, or lamivudine, or if you also take dofetilide, Tikosyn. You have moderate or severe liver disease. You have a gene variation called HLA-B 5701 allele, your doctor will test you for this, or you have a history of allergic reaction to Camavir, Dutrabis, Epivir, Epzicom, Tivicay, Trizavir, or Zygen. To make sure Triumeq is safe for you, tell your doctor if you have liver disease, especially hepatitis B or C, heart problems or risk factors such as diabetes, smoking, high blood pressure, high cholesterol, or kidney disease. You may develop lactic acidosis, a dangerous buildup of lactic acid in your blood. This may be more likely if you have other medical conditions, if you are overweight, or if you are a woman. Ask your doctor about your risk. You may need to have a negative pregnancy test before starting this treatment. Abacavir, dolutegravir, or lamivudine could harm an unborn baby if you take this medicine at the time of conception or during the first 12 weeks of pregnancy. Use effective birth control to prevent pregnancy, and tell your doctor if you become pregnant. If you are pregnant, use your medications properly to control your infection. HIV can be passed to your baby if the virus is not controlled during pregnancy. Your name may be listed on a registry to track any effects of antiviral medicine on the baby. Women with HIV or AIDS should not breastfeed a baby. Even if your baby is born without HIV, the virus may be passed to the baby in your breast milk. How should I take Triumeq? Take Triumeq exactly as prescribed by your doctor. Follow all directions on your prescription label and read all medication guides or instruction sheets. Triumeq tablets are not the same as Triumeq PD tablets for oral suspension and should not be substituted for each other. Make sure you receive the correct dosage form each time your prescription is filled to avoid using the wrong medicine. Doses are based on weight in children and teenagers. Your child's dose may change if the child gains or loses weight. Do not swallow, cut, crush, or chew a dispersible tablet. Dissolve the tablet in a small amount of water. Stir and drink this mixture right away. You may take Triumeq with or without food. Triumeq comes with a medication guide and a warning card listing symptoms of an allergic reaction. Read this information and learn what symptoms to watch for. Keep the wallet card with you at all times. You may need to take an extra daily dose of dolutegravir, Tivicay, if you take Triumeq with certain other medicines. Use all HIV medications as directed and read all medication guides you receive. Do not change your dose or stop using a medicine without your doctor's advice. Every person with HIV should remain under the care of a doctor. Store at room temperature away from moisture and heat. Keep the tablets in their original container, along with the packet or canister of moisture-absorbing preservative. If you've had hepatitis B, it may come back or get worse after you stop using Triumeq. You may need frequent liver function tests for several months. Dosing information. Usual adult dose for HIV infection. 1 tablet orally once a day. Use, for the treatment of HIV-1 infection. Usual pediatric dose for HIV infection. At least 40 kilograms, 1 tablet orally once a day. Use, for the treatment of HIV-1 infection. What happens if I miss a dose? Take the medicine as soon as you can, but skip the missed dose if it is almost time for your next dose. Do not take 2 doses at one time. Get your prescription refilled before you run out of medicine completely. If you miss several doses, you may have a dangerous or even fatal allergic reaction once you start taking this medication again. What should I avoid while taking Triumeq? Using Triumeq will not prevent your disease from spreading. Do not have unprotected sex or share razors or toothbrushes. Ask your doctor how to prevent HIV transmission during sex. Sharing drug or medicine needles is never safe, even for a healthy person. Triumeq side effects. Call your doctor at once if you have symptoms of an allergic reaction from 2 or more of these specific side effect groups. Group 1, fever. Group 2, rash. Group 3, nausea, vomiting, diarrhea, stomach pain. Group 4, general ill feeling, extreme tiredness, body aches. Group 5, shortness of breath, cough, sore throat. Once you have had an allergic reaction to a medicine that contains Abacavir or dolutegravir, you must never use it again. If you stop taking Triumeq for any reason, talk to your doctor before you start taking it again. Call your doctor at once if you have other signs of allergic reaction: skin blisters or peeling, eye redness, swelling in your face or throat, trouble breathing. Lactic acidosis, unusual muscle pain, trouble breathing, stomach pain, vomiting, irregular heart rate, dizziness, feeling cold, or feeling very weak or tired, or liver problems, swelling around your midsection, right-sided upper stomach pain, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. Triumeq affects your immune system, which may cause certain side effects, even weeks or months after you've taken this medicine. Tell your doctor if you have signs of a new infection: fever, night sweats, swollen glands, cold sores, cough, wheezing, diarrhea, weight loss, trouble speaking or swallowing, problems with balance or eye movement, weakness or prickly feeling, or swelling in your neck or throat, enlarged thyroid, menstrual changes, impotence. Common Triumeq side effects may include headache, tiredness, or trouble sleeping. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects.